Hey guys, it's Dr. Bailey with Dr. Bailey's Evolved Health and Wellness, another Medical Monday. We'll give some folks just a few seconds to get up here and get online. Hope everybody had a good weekend. Getting clinic finished up here. Typically runs clinic right up to the beginning of Medical Monday, so it's usually kind of a rush to get everything up and going. I am going to add the link in the comments here for the fight in Oklahoma City that I'll be a part of October 24th. Um, we're actually going to give away some tickets to that fight as well. It should be a really entertaining event. On top of that, I'll be there fighting, and there'll be, like I said, there'll be some good entertainment there. We're going to give away four general admission tickets. To be entered, what has to happen, they have to like the video, share the video out, and then we'll get some folks entered into that. Um, it's something I've been doing for a long time. It keeps me actively training and in shape. It's something I'm a big believer in as far as fitness, as I think everybody's kind of seen throughout these times. Today, interesting topic. Today is dementia and Alzheimer's. And what I've tried to do with it was look at what we know about those two specifically. And then there's a couple other little medical things that we're going to talk about that kind of correlate with that a little bit. And dementia and Alzheimer's kind of being grouped in together. And right now, especially in what we consider a geriatric older population, and right now, pardon me, I think it's considered 60 and above, but it's the number three leading cause of death in those groups. There's a bunch of different thought processes as to how and why, but you know, many times people get confused and they're trying to separate, dementia versus Alzheimer's versus others. And the what it basically comes down to is Alzheimer's, by definition, is technically diagnosed after death. The difference between Alzheimer's and routine, what we call regular or vascular dementia or Lewy body dementia, is because of the amyloid plaque deposition. So amyloid plaques are protein. We'll just say protein clumps that are in the brain cell or around the neurofibril tangles of the brain, and that's really only seen on microscopic exam. From there, generalized dementia is something that happens with age, and it can be caused from vascular issues, high blood pressure, cholesterol deposition, or plaque deposition, those types of things. And we see it predominantly in patients. We're seeing it in a much higher rating in the Midwest right now. Now, a couple things that we know outside of the cannabis realm, when it comes to dementia and Alzheimer's, the number one way that we've learned to prevent or decrease these over time is learning new activities. You learn something new. And if you've ever seen the silver classes that pop up in the YMCAs and a lot of the junior colleges and whatnot, those are intended to break a cycle and allow you to learn a new activity. It triggers neuronal or nerve cell development and production, and helps prevent the onset of Alzheimer's or the onset of dementia. Now, the when it comes to Alzheimer's, we have learned and we have seen there's several studies that are out. Let me see if I can find. There was one that talked about here, and this is just one article that I found, but there was several that talked about how cannabis prevented or decreased the likelihood of developing these amyloid plaques over time. Now, what causes amyloid plaques in Alzheimer's dementia? We're unsure. We think it's inflammation based, which makes sense as to why cannabis would help prevent that development over time because it's a very potent anti-inflammatory. Now, let's see here real quick. Let's look at the comments. Blake Pierce, hey, I appreciate it, sir. We're working hard, but we're going to get some time off the week after the fight. Ms. Sanchez, nice to see you in. Chance Seeker. Fight night is October 24th. Now, back to cannabis and so or Alzheimer's. Now, with Alzheimer's, what happens is it's a progression. And as many people know, I'm also a medical director for St. John's or Ascension, which is now combining with Compassus Hospice. And I see this a lot in our hospice patients that as we develop dementia, um, Agitation usually comes along, and that is always something that we're always overly conscious with when you have, and not to go one way or another, but when we have an older male living with his longtime spouse and he's developing dementia or Alzheimer's, because what happens is a level of frustration and sometimes anger can be lashing out. And it's just because of a not understanding why people are frustrated or not understanding what's going on around you leads to that anger and those outbursts. Um, let's see here. Chance seeker, dopamine reuptake. Absolutely. And so what we try to see is, what's out there to help with this, with to protect in the realms of dementia and Alzheimer's. So cannabis is a phenomenal treatment alternative. The terpenes that we look at, delta 3 carrying is a great one. It's not a very common one. Alpha and beta pinene actually do a really good job in this as well. Let's see, there was another one. Eucalyptol is another really good one. Um, GABA. So Chance mentioned something about GABA in here briefly. So GABA does help. GABA is found in a lot of times with some sleep aids as well. So GABA helps with memory retention. That's why whenever we drift off into sleep, we want to try to get into REM sleep, because REM sleep helps our brain transform short-term memories into long-term memories. That's why it's so important if you're in college or you're going back to school and you're trying to learn something. It's really important to try to get some sleep in there, because that REM sleep is what helps solidify memories. I've been there. I've done the whole staying up, pulling the all-nighters. Um, it's something that we shouldn't do, but inevitably we all do. There's always a little bit of procrastination that leads to that. So um, now, going back to cannabis, we know that THCV does a great job. So does CBG. So does CBN. Now, the only bad or negative side of CBN is it is relaxing. It is kind of what helps contribute to a really good night's sleep. So when you're looking into strain or endocannabinoid selection, that is something to always take into consideration with that. Now, one of the things that I wanted to talk about, and this kind of veers away just a touch, but anytime Chance says pot sleep is not REM sleep. Yes and no. So pot sleep will allow you to, when you say pot sleep. So what we know with cannabis is a mental emotional relaxant, right? It slows down thought processes to the point to where you're not overly stressed or overly analytical or not overly thinking. But we do know that you can still slip into REM sleep actually just as easily and better than if you were on Ambien or Lunesta or anything along those lines. Now, one thing that kind of jumping back, I hear about a lot: ADD, ADHD. Um, it's one of those things that we see a ton of people, especially younger folks, but a ton of people on Adderall, Ritalin, methylphenidate, Vyvanse, all these other medications. And what we are starting to see is a exponential increase in the number of patients developing early onset dementia with Adderall use or Vyvanse use or methylphenidate or any of these other medications. We know that these medications trigger dopamine and serotonin and different chemical neurotransmitters. Now, part of the problem with that is that over time, the body habituates to it. And we're still looking at the downstream effects, but that has been the one risk factor that we've seen, is that there's an increased risk of this happening long term with long term Adderall. And I say this as, when I was really young, I was placed on Adderall. ADD, ADHD as the day is long, still am. And it wasn't until about medical school that I weaned myself off. And I was on a very high dose just because I was kind of here, there, everywhere. And I was one of the people that sat down and I did the 8 hours clicking at a computer type deal. And that's how they diagnosed it. And so I had a psychologist, psychiatrist as well that kind of monitored me monthly, talked to me, make sure I wasn't having any agitation issues and stuff. But one of the things that I found is, yes, I could study for days. Yes, retention was pretty solid, but I couldn't maintain weight, couldn't, I was agitated. There was some other issues that went along with it. So I finally just weaned myself off. And what we know is that it's a much, much, much better alternative to treat ADD and ADHD with high doses of caffeine versus Adderall or methylphenidate. Now, Miss Bauman, I never get REM sleep. So one of the things that I have found, and I might see if I can find them. There is a little non-cannabis related gummies, but they're little gummies that have melatonin as well as GABA in them. And they do a phenomenal job for me. And I'm going to actually post the Amazon link at least over here to them and see if maybe that can help some other people. They it doesn't put me to sleep as far as put me to sleep, but I definitely feel much more relaxed. It's something that sleep has been overlooked by so many people. One of the things that I also wanted to talk about real quick, and I probably need to do a whole new talk, separate talk on ADHD and ADD, but just to address it here. One thing that we know is it's somewhere in the range of 90 to 95% of people with ADD and ADHD actually have severe underlying anxiety. And by calming and treating the underlying anxiety, the ADD and ADHD actually improves. You're able to focus and get your normal activities performed or study or read or whatever that may be, because you're not so anxious about performing these other tasks or getting these tasks done to standard, and that allows you to do pretty well. Let me see here. I think I got everybody caught up. Okay. And so, briefly, kind of recapping dementia and Alzheimer's. So, one of the big things, especially if you have an older family member, and I used to see this all the time in the hospital setting, especially, is a family member would come in confused, and we're trying to determine what was going on. This is a patient in the 60 to 75-year-old range, and we talk to the family members. I'm like, well, they've done really well. We go see them all the time. They're not ever confused. One of the ways to test the family member is to bring them out of their routine. So if you take a family member that you're concerned about, have them come stay a weekend with you. Take them on a vacation. Take them out of their normal routine. Take their keys from where they would normally set them and set them somewhere else. And I know that sounds kind of mean, but the whole process is when we break the routine, that's when the confusion starts to become more apparent. That is something to kind of look at, especially in if you have patient or family members that you maybe care for, or you're concerned about, hey, do they have dementia? Is there issues there? That is something that has always been kind of a true fail-safe deal. Another quick thing, kind of off topic, but with dementia in our older patients, and I had this happen to a patient of mine, it's a cannabis patient. I just happened to know him outside of the cannabis and medical world. And we were sitting and talking. He was like, man, my mother just crazy today. We couldn't figure out what was wrong with her. She was trying to put her shoes on the dog. All these different things were going on. In an older patient like that, I say older, anyone over the age of 55, acute onset of confusion. Two things. First, infection. Second, medications. So look at those two things really closely. And in a female population, urinary tract infection is a big one. That I've seen some folks get diagnosed with dementia and some of these other issues when it wasn't that at all. When in fact, it was just an underlying infection that caused some confusion. Happens. I mean, I could not even begin to tell you the hundreds of times a month or maybe even a week that happens just here in Tulsa. So if you go outside of that realm, it's a big deal. All right, and see, make sure I got everybody. Boom, 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 boom. Again, guys, like and share this video out. We're gonna put some people's names for giveaways, 4 tickets to the fights in Oklahoma City, October 24th. I'm super excited about it. I use that as an alternative for exercise, kind of give me focus and whatnot. But I again, big time fitness, big time in health. I talk to a lot of patients that come in to get their cannabis licenses, and they want to, and a lot of times it's an issue with obstructive sleep apnea, hypertension, pain, especially back pain. 9 times out of 10, we can fix a lot of stuff. Cannabis is great because it helps us sleep, helps us recover, mood is better. Diet and exercise is a huge, huge deal, and it's just a fun night. I mean, I'm not gonna lie, I'm super excited about that. All right, what big questions? Let me look all over our links here. Bum, bum, bum. I think I got everybody caught up. Again, renewals are going through right now for both Oklahoma and Arkansas. Oklahoma renewals, please check your license. Talk to your friends that you know that have cannabis license and be like, hey, when's your license expire? Right now, I know that we are personally booked out till October 12th, I believe, going into the 13th. So make sure you really need to try to be seen about a week before your license expires to get everything done and get your license in time beforehand. Now, they are being kind of fickle. If you're past your expiration date, they're going to want you to submit a whole new application. It's pretty much a whole new application anyway. Just instead of typing in your information, you are it's auto populated if you're going to renewal. Any big questions? Spotman, talk to you tomorrow. Yes, ma'am. All right, y'all. Again, if there's a topic that you're curious about, so when we talk about, again, just quick summary, Alzheimer's and just generalized dementia. So dementia is broken down in Alzheimer's, Lewy body dementia, vascular dementia, a bunch of different causes and topics. Usually accompanied by age. We can prevent it by learning new activities, learning new hobbies, going back to taking new classes, those types of things. Alzheimer's, the preventative mechanisms are not great. Now, cannabis does a great job. We are starting to see a significant improvement in patients that use cannabis and having decreased um, amyloid plaque deposition in the brain. That's just one of the many benefits there. So definitely something to look at. Try to avoid things that leads to long-term risk of dementia. Benzodiazepines, Xanax, Klonopin, Ativan, those are big, big, big medicines that lead to those deficits. Another thing that leads to dementia from a ton of studies. Chronic alcohol use is another big, big thing. That's something that I would love to replace as much alcohol and cigarettes with cannabis as possible, especially benzos and then opiates down the line. Opiates are another medication that has a high risk of leading to not just dependency, but dementia in the long term as well. Thank you both to the Bachmans. You guys are awesome. I will let everybody go. If there's anything that you need from me, by all means, feel free to shoot us a message over to the Evolve page. I'll get you taken care of personally. Y'all have a great week.